Today we're going to talk about something very important for our beloved children. And this is something new. Most of us does not know about it, which is third-hand smoking. What is third-hand smoking? First, let's start with the first smoking. First smoking, when you smoke, and you will hurt yourself by smoking cigarette or e-cigarette. So this will affect you and your lungs and your health yourself. So this is what we call first-hand smoking. Now, second-hand smoking, if somebody around you, he will inhale the smoke and he will start to be also affected by your smoke, like in harmful way. Now, the third-hand smoking is something new. They just found it out about 2006. They found that even if you smoke now and you hurt yourself and you hurt the people who is around you, there is another part of this problems, which is the third things. The third thing is the smoking. When you spread in the air, it will go to around you. It will last for a few minutes, then it will subside to the surface in the area. Now, the smoking itself will take short time, maybe 1 to 3 minutes, and then it will disappear if there is like good ventilator. The same for the second-hand smoking. The person who is around you, he will inhale this smoking for also short period of time. But the third smoking, it will stay on the surface for longer time. And that long time, it is long. Sometimes months, sometimes years. So what's happened is this smoke particles will subside to the surface, and like the walls, the furniture, the tables, the floor, and it will start to react to the material in that surface. And so it's not a harm by itself only, but also when it starts to react with this material, it will start to produce some worse pollutions, and like nitroamines, especially nicotine. It will react to that oxidate particles and start to produce what we call carcinogenic materials. So why this is very important? Because the surface is the area where our toddlers, our children play, and so they play all the time there. They are crawling there, they are playing football, they are playing with their toys, they are touching. So whenever they touch this area and this area is contaminated with that pollutions, it will affect them. Not just immediately, it will affect them immediately and in the future, because it can cause some problems like cancer and irritation and asthma and eczema. So this is what's new about the third-hand smoking. We find out that this material can cause more problems for the children, even if you are not smoking around them right now. So if you go to the room where somebody has smoked before, that material is still in that room, and it will last for days, months, and some of them it will last for a longer time. Depends how often you clean the room, how often you do the ventilation. So, and this material is very dangerous because it can cause cancer by itself, and can cause cancer when it reacts with other oxidants in the area, like ozones. And ozones, and it can reduce in every house, every room, from the gas, from the oven gas, and from the electricity, and it will go around us because it's around us anyway. So when this material will react with the nicotine and start to produce this kind of nitrosamines, which is carcinogenic, it will start to affect our kids. Not that only, but also it can produce smaller gases than the smoke itself, and these gases can go deeper in the lungs of our kids, and can make the asthma worse, can cause allergy for the nose, allergy for the skin, eczema, and etc. And it's very hard to clean. So by opening the windows, you will get rid of the smoke, but you cannot get rid of that materials. That material will stay for a long, long time. And this is why most of the pediatricians and most of the health doctors, they start to think about this third-hand smoking as more important than second-hand and first-hand smoking because of the bad effect of the kids, especially when they are crawling, they are touching, they want to investigate everything. And you know, the toddler, he go around, he touch, he put everything in his mouth. So this material not just in his hand, but also goes to his tongue, to his mouth, to his stomach, and to his body. The same when if you are smoking, if you are not necessarily smoke, if you are exposed to smoke outside your house, and you come back from your work to your house and you are not cleaning yourself, you forgot to clean your hand, or so when you hold your child, he will be exposed to that material. So this is why it's very important to be aware about this risk factors, which is, as I said, we start to find more about it since 2006. So my advice for every parent, do not smoke at all. And if somebody smoke around you, you need to teach him that smoking not just will affect him, it will affect everybody around him, and it will affect the person who will come to that places, to that room after him, including our kids and our toddlers. So please, please, please do not smoke.